Hi, my name's Phil. I like talking about politics, and in this video, I'd like to discuss some of the more notable scenes from the COVID inquiry this week as former Health Secretary Matt Hancock took to the witness stand again to be torn to pieces. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So, Matt Hancock was a bit of an aberration in Boris Johnson's government. He wasn't really one of the crowd. I said at various points in 2020, when people were calling for him to be sacked, I thought, Johnson might do so at a time when it would help him to dump all of the blame on Hancock, right? In the end, Hancock was forced to resign, not quite under the circumstances I expected. James O'Brien at various points in 2020 would say, "We see you, Matt Hancock," implying that the health secretary was better than this, that we were disappointed with him, that we expected it of the likes of Boris Johnson, but not Matt Hancock, that he had a conscience. Now, I'm not sure that O'Brien thinks that now, but there was certainly a sense in which many people felt that Hancock might have done better, that he might have at least tried. But did he ever really try to be a good health secretary on any level? I think I might do one of my proofs by contradiction again. Let us assume that Matt Hancock tried and see if it's possible to justify his actions or inactions in some way. So let's begin when Matt Hancock became health secretary. Theresa May was the prime minister, Operation Cygnus had already taken place, and his predecessor did little to implement the recommendations. Shouldn't Hancock, if he wanted to be a good health secretary, have wanted to move on that? Nothing to do with hindsight. The government had already established that a global pandemic was the number one security threat to the nation, and the 2016 Operation Cygnus exercise had highlighted how badly prepared we were. This will have been discussed at Cabinet. He was a member of that Cabinet. Well, perhaps he wasn't aware that progress had fallen behind, or maybe he was distracted by the day-to-day problems in our healthcare. It had already spent 8 years being undermined by predecessors in the role. After all, a pandemic is still hypothetical, might not happen for 5 years, 10 years, 20 years, who knows? But the problems in the NHS would have been in the here and now. So then COVID comes into view. First in China, where severe lockdowns are required, Asian democracies adopt wide-ranging mitigations in order to avoid the need for those lockdowns. The use of face masks and social distancing where possible becomes the norm. Then it sweeps into Europe. It cannot now be denied that this is clearly a global emergency. The UK is still sort of not being hit as far as Hancock is concerned, but time is surely of the essence. Wouldn't now be a good time for a health secretary who wanted to do a good job to decide that actually now the pandemic is not hypothetical, it's in the here and now. They should want to get themselves up to speed on pandemic readiness and what he can do to prepare with limited time before we can expect to be hit. So now let's fast forward to the COVID inquiry this week. Matt Hancock was shown a document. Now this was from late February 2020, so we had already been hit. At this point, the first case in the UK had been recorded like 3 weeks before. The document from Public Health England says that there should be no discharge into care homes because of the risk of infection. Now we know that there was lots of discharge into care homes. Hancock is referred to the document at the inquiry. He says he never saw it at the time. Why not? This sounds important. A deadly virus, which is especially deadly to a very elderly and vulnerable population, people who live in care homes. Why wouldn't he be demanding to know everything? We know he's not going to read every single document within his department. But why wouldn't he be demanding of his officials to know everything which will be necessary for him to form policies on protecting the citizens of this country? Something like this is absolutely essential for the health secretary to know in order to form policy on shielding in care homes. And this was not a one-off. Hancock had said that he did not read the SAGE minutes early on in the pandemic. Now, SAGE is the Scientific Advisory Group for Emergencies. As the name suggests, it's scientific experts who advise the government on emergencies. Why wasn't the health secretary reading what they had to say? Does this sound like the behaviour of a health secretary who wanted to step up to the crease and shine in this emergency? Sounds to me like the behaviour of someone who was either not taking the pandemic seriously, like Johnson, or did not consider that he had a duty of care to protect vulnerable people or the health service, again like Johnson. And whatever the reason for his dereliction of duty, I mean, it's done now. We're trying to learn lessons. Is Hancock at least reflecting and deciding, right, I need to engage with the inquiry in order to give them as much useful information as I can so that we can at least prepare better for the next pandemic? Am I going to play my role in the future preparations? Assuming the next pandemic gives us a good 10 years to do so, because we may need at least that. In a word, no. He was caught out in certain and probable lies really very often. I mean, was he under oath? I think he was under oath. He should be in trouble. We can only conclude that Matt Hancock, just like every other politician and political advisor to a peer, is basically looking after his own arse. Hancock insisted that he told Johnson to lock down on March the 13th. Where's the evidence for this? The lead counsel, Hugo Keith Casey, says, well, this wasn't mentioned in your book. Matt Hancock wrote a book, thought he was going to make a load of money, hardly sold any copies, and he ended up giving giving a load of sensitive information to someone he should not have done. But anyway, Hancock says in response to this that, I didn't have full access to all the papers at the time, that's why. And then Hugo Keith, who's the barrister questioning him, says, well, in the book you claim that you had all the papers, notes and memos, but there's no reference to telling Johnson to lock down on March the 13th. Hancock tried to say that it came to light as he prepared for the inquiry. But that is changing his story. First, he's saying he didn't have full access to the notes. Then when he's told, well, you said you did, he then changes it to, okay, but I didn't go through them all. That is a difference in the story. He's changing his story. Another was regarding a phone call. There's a record of a phone call, which Hancock claims came to light since. Keith says, well, hang on a minute. The inquiry has tried to gather all relevant documents. We've made a really big fuss about this. He asked Hancock if he was referring to a record of a phone call not disclosed to the inquiry. Hancock then realises he's basically admitting to withholding evidence from a public inquiry and tries to change his story again. Oh no, it's only the record that the phone call took place, not the record of the phone call. But I remember exactly what was in that phone call like 3 years ago. If he tried his best in 2020 but simply made mistakes, there would be no problem giving full and frank answers to the inquiry. The inquiry is not political. It's not after retribution. It's not after making ministers squirm like I might want to. Indeed, it has no powers to press charges. And those who do have the power are not going to press charges for mistakes that were genuinely made. That's not illegal. It may be that what they have done is not necessarily illegal. We don't know yet. But that Hancock has tried to mislead the inquiry, has tried to rewrite history, has reportedly sought immunity from prosecution before first giving evidence earlier this year, suggests that not only was he not trying his best, but he knows he wasn't trying his best, and he knows that the evidence makes this clear, unless he can try and blur the lines. In fact, there was a really telling discussion with Cabinet Secretary Simon Case from the end of October 2020, which was the height of the second wave. So Case is talking about a meeting, and Hancock is concerned that Sunak, who's the Chancellor at the time, in this meeting with Johnson, will try to persuade Boris Johnson against action to slow the spread of the virus. Hancock says, this is the quote, "Rishi is in the room contrary to the stupid rules, so the PM will be under enormous pressure to not do enough once again." Now, lots of people have seized on this comment because it shows that Sunak actively worked against mitigations and other measures which could have saved a lot of lives. In other words, Dr. Death is responsible for more lives. But the comment doesn't actually show that. It just shows that Hancock thought that Sunak was doing so. Now, that's his opinion. It may or may not have been an accurate opinion, but that's Hancock's opinion. But there are two things that are much more telling in that statement. The first is that he is saying that Sunak is in the room with Johnson when he should not be, and that this is not a one-off. Now, we know that lots of staff in 10 Downing Street routinely broke the rules. There's plenty of evidence of that. But this is now evidence that Sunak routinely did so as well. We know that Sunak got fined for that one event where he was probably called to it anyway. But this is now telling a picture of Sunak breaking social distancing rules routinely. The second point is Hancock referred to, contrary to the stupid rules, he said, stupid rules. A clear case of not understanding or having faith in the rules that his department ultimately produced. How on earth was the Health Secretary supposed to do anything of use if they did not even believe in the measures they were promoting? He described his own rules as stupid. What this week means is that for those who may have sort of thought that Matt Hancock was maybe someone who could have been a decent minister if there'd have been a decent government around, and he just trashed his reputation because he was led astray by Boris Johnson, no. There's no evidence that Hancock even tried to help. That he might have urged mitigations and earlier lockdowns is because it reflects badly on the Health Secretary when healthcare services collapse. It's purely about the numbers, not the lives. There's no evidence he had any regard for any human life. In fact, a message from one of his advisors makes this point. The advisor is discussing deaths, not as a bad thing in itself. The advisor's basically saying, oh, they've come to the end of their... Parroting Boris Johnson, they've come to the end of their life, they've had a good innings, you know, it's fine. They were concerned about what the newspapers would say about it. And you could say that's a reflection on the advisor, and to an extent it is. But remember, that advisor is also reflecting angles that they know that Matt Hancock wants to hear. You know, Matt Hancock is as bad as any of those who sought to profit at the expense of so many lives. Just as bad as Johnson, just as bad as Sunak or Cummings, or anyone else who acted selfishly when the nation needed a strong government. Absolutely zero evidence has come out at this inquiry that Hancock cared for anything or anyone but himself. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.